know that you practice EMDR. Tell us about it, what it is, what it does, and how it can work to help PTSD.
Well, it's actually very similar to trauma-focused CBT. So if trauma-focused CBT is about processing the memory, creating a useful meaning, and reducing avoidant coping, EMDR helps the person, enables the person to bring to mind the worst moments of the events and to recognize the feeling that goes with that and to acknowledge the thought that goes with that event. I'm going to die might be the thought. And then also to bring in a more useful thought, but I survived might be the thought. I'm strong, I'm resilient. And then you bring all of that to mind whilst having some other stimulus as well. So it's very often eye movements. So you might be following the therapist's fingers whilst you focus on all those things.
So you would have a patient, they can be maybe talking out loud what they went through, this traumatic experience, and you'll be moving your finger like that in front of them.
Yeah.
And they just have to watch the finger.
Yeah, and bring up the feeling, the thoughts, where in the body they feel that, how strong is that feeling.
So how long would you be going like that in front of someone's face for?
Well, you might have a whole session, but you would stop. Yeah, you would have quite a lot of preparation and some time afterwards to kind of reset. But it could be most of the session could be the processing. And you start with that worst moment, you do the eye movements, and you then take a breath and go, what have you got now? And often the image will fade, or the image will move on to the next step. And the thoughts, you get them to rate how strongly they believe the different thoughts. And all this helps them to, if you like, it breaks the link between the negative thought in the event and strengthens the link with the positive thought. I'm resilient, I survived.
So how does that work? What's it doing to the brain? Why is staring at your finger going back and forwards while you talk and feel something traumatic? How does it eliminate it?
Yeah.
It's fascinating.
It is. We don't know how it works. And people that say they do know how it works, I think are guessing. I don't think we have any clear ideas yet of how it really works. We know that it does work, so there's enough evidence to show it works, particularly with adults, but also with children and young people.
Can you do it on yourself?
Yeah, you could do.
Really? You could sort of sit at home and just go like this?
Yeah, or you can have, also you might tap your knees, or some people do a butterfly hug where they put their arms across.
But do you have to stare at your hands?
No.
So you could just be going like this while you're talking through?
Yeah. But working with children and young people, I prefer them to do the processing not on their own.
Yeah.
I worry a little bit about what might happen if we say, all right, go off, this is your homework, go and think through the worst moment of your life when you thought you were going to die. You know, I'd much rather they do that either in therapy or with their carers. And we don't really know whether this actually is an important component, I would say, based on the evidence. Other people would say this is absolutely vital. I'm yet to be convinced by the evidence. And the evidence generally is stronger for trauma-focused CBT, so the revision of the NICE guidelines for PTSD said do trauma-focused CBT first. If that doesn't work or the person doesn't like it, then do some EMDR.
YouTube viewers, I really appreciate you watching that video. It would be wonderful if you hit the red subscribe button. It costs you nothing and it means that you'll get notified whenever I post a healthHackers video. You can follow me on social media too. Handles right beneath me. I love hearing from you. Bye bye.